developed some swelling in my legs and a little bit more swelling in my left leg than my right leg, and went to my general practitioners and made an appointment, went in and saw him, and you know, I kind of figured that I would get a pill or a prescription or a shot and it would just take care of it, and really didn't have any idea what I had. It was explained that I had some form of edema and that my body was retaining fluids, but he had no idea why. So they took blood samples and ran tests on the blood samples, and then about a week later, the doctor called me in to review the blood tests, and then he told me that I had chronic hepatitis C, and that the indications were from my levels that it was active and I needed to seek treatment, you know, very quickly. The primary fulcrum for everything was my general practitioner. So, you know, I went back to him. He had a referral for me to contact Scripps Research Clinic. They had a case study program continuing and ongoing, and they wanted to see if I would qualify for the program. And one of the things they needed to qualify me was they were going to need to have a liver biopsy. And since I was employed at the time, my insurance would take care of it with a little bit of red tape, because I had to go outside of my HMO to get the biopsy. The bad news that came out of that was that my liver biopsy showed some necrosis, and it showed sclerosis in my liver, and my liver had been degraded due to the chronic hepatitis virus. He told me point blank, either you get treatment right away or this disease will kill you prematurely. My understanding of the TELEPRIVIR is it does not treat the hepatitis directly. The hepatitis C virus is a replicating type of virus that grows inside your liver, which causes the chronic problem, the way I understand it. And the TELEPRIVIR basically is a drug that prevents your body from creating a certain type of protein or an enzyme that the virus requires to replicate itself. Every week in the beginning of the program, every Friday, I went to, gave a blood test, and you know, they took blood, and then that would later document my viral count, my white blood cell count, my red blood cells, things like that. And they were able to monitor the progress that the TELEPRIVIR and everything was making. So the TELEPRIVIR was the additional drug by the Vertex Corporation in the purpose of the case study, and that's a 12-week course. So it was the first 12 weeks that I took the TELEPRIVIR every 8 hours. So it was 2 pills every 8 hours around the clock. So my personal philosophy was, this treatment has been paid for by the Vertex Corporation, and even though I could probably stop taking all these drugs right now and be fine, it benefits that company to get this drug approved if I finish the program. And so even though there's still side effects from the interferon, I have a lot of joint pain with that, and there's side effects from the ribavirin that I take, I'm going to continue the program until November, which is when I'm slated to end all the drug treatment and then just go into monitoring. I'm in my 7th month. The worst of the worst is over with at this point, and I feel pretty good. I'm still not 100% of where I was before, you know, I started to go downhill from the disease, but I do feel so much better than I did just a few months ago, and so I'm very confident that I'm really looking forward and confident that when I come off the drugs, I'm going to feel a lot better, and a lot of the other side effects that are affecting me right now are going to go away, and I'll continue to have a normal, healthy life.